laying in bed, feeling like somebody jabbed a needle between my toes, and then one behind my knee, and then one in my thigh, and then one in my head. And they're like, shocking, right? Do you know what I'm talking about? Body shocks, a zapping under the skin, sometimes in the arms, all over the body. It doesn't discriminate. It could quite literally be anywhere, I believe. And it can wake you up. You could be walking through the grocery store and all of a sudden your leg wants to like kick. Yeah, body zaps, comes out of nowhere, appears fast, goes away. You operate out of fear when all of this happens. Dr. Heather Hirsch, patients call these zingers. I called them body shocks. I called them excruciating, painful, stupid, awful. And they're documented. They're a documented perimenopause symptom that almost nobody talks about. I didn't know about them. I went down a Google scroll hole on this. It was terrible. Today, we're going to talk about the neurological and sensory category that is applicable in perimenopause. The one with the biggest I have no idea factor. Yep. These symptoms are rarely connected in perimenopause in clinical settings. Rarely connected in clinical settings. Because your doctor had how many hours of education? Somewhere between 1 and 4. Proven. That is exactly why they are on this list. Estrogen has, if you've followed along, you'll know, neuroprotective properties and anti-inflammatory roles throughout your entire nervous system, your nerves. Have you ever looked at a diagram of your body nerves? Crazy. It's all over the body. So when your estrogen fluctuates, your nerve function is affected. Sensory processing is affected. And the result is a range of neurological symptoms that can feel alarming and get consistently misattributed to something else. The nervous system is estrogen dependent in ways that are rarely ever taught, even in medical training. This is not fringe information. It is documented across peer-reviewed research and in 6 major books on this topic. All right, neurological symptoms. That's what we're going to hit today. Electric shock sensations, or people call them zingers. Brief zapping sensations under the skin or in the brain, not a sign of a neurological problem. Zingers, they're uncomfortable. They suck. Next, tingling and numbness, paresthesia, arms, legs, hands, feet, nerve related. Symptoms from hormonal and circulatory changes. Frequently sent to neurology before anyone checks the hormones. Have you ever gone to the doctor and they're like, oh, you need to go see somebody with the brain, and you're like, now you're going to know maybe you should look at the hormones. All right, burning feet. This is one I haven't had. Now I'm going to call it in. Anyway, burning feet. Feeling like your feet are on fire, particularly at night. Nerve function is affected as your estrogen declines, underdiscussed, underdiagnosed, and it's a perimenopause symptom. Next, I wish I would have known this a long time ago. Tinnitus. Ringing in the ear, buzzing in the ears. Now, this is not to say you don't have extenuating circumstances, such as I was in the Army and I shot a lot of weapons. So that could be a lot of it, but it's definitely getting worse. As I've gotten older, these are the things you need to pay attention to, take notes about, and present to your physician. But tinnitus, ringing or buzzing in the ears. Auditory processing involves estrogen. What doesn't at this rate? And can emerge and worsen in perimenopause, often investigated as an ear problem without hormones ever being considered. Dizziness and vertigo. I hate vertigo. I have experienced it a few times in my life. The dizziness is something that is starting to come in. Your inner ear also, surprise, has estrogen receptors. Benign positional vertigo increases during perimenopause transition. Women often go to the ear, nose, and throat specialist without a hormonal conversation ever happening. Dry eyes and blurry vision. Yep, don't like this one either. Also related to, any guesses? Estrogen. Estrogen provides lubrication throughout the body, including your eyes. Corneal changes can affect your vision clarity. I'm experiencing this and is often treated as a standalone eye problem. Burning mouth syndrome. This is something I've also not experienced, knock on wood, not trying to call it in, but burning sensation in your mouth, gums, or tongue. Estrogen receptors are in your mouth. One of the most isolating symptoms because it sounds implausible until you understand the mechanism. Gum and dental changes. Yep, I thought I had periodontal disease, whatever it's called. Oh my God, the bloody gums. Increased risk of gum recession and sensitivity because your oral tissue has what? Guess, estrogen receptors. Your dentist might notice changes before your doctor actually ever connects it to hormones. Formication. This one. Crawling skin. Don't like it. Nerve related. Described as feeling like you have ants or bugs under your skin. I once had a girlfriend whose mother went through this and had multiple surgeries. And now I wonder, was it hormones? No rash, nothing visible, hormonal, and documented. It's a thing. These symptoms can drive us, women, uterus-bearing individuals, down an expensive diagnostic rabbit hole to receive no answers. If we looked at our hormones, we might be able to start mitigating things and changing things in order to affect change in our body. Staying out of ear, nose, and throat, ophthalmology, cardiology. But when it comes to them, like heart, it's worth going to see somebody just to rule it out. But the hormone question almost never gets broached, and it's infuriating. The cost of this isn't just financial, it's emotional, it's time. Like, who has more emotions and time to give up right now? And oftentimes you will leave feeling more fearful because you got no answers. Name it. Understand it. Research it. Talk to your doctor. Bring it into the room with you. Write it down. Document it. Don't dismiss it. Don't gaslight yourself. Trust your experience. All right. I feel like these get so heavy. Next episode is going to be joint pain and frozen shoulder. The musculoskeletal category that gets blamed on quite literally everything except hormones. I mean, are we sensing some themes here? Which of these neurological symptoms that we talked about today have you experienced or had a friend experience? What has been your experience? Have you had a doctor who has listened to you or a nurse? I'm curious about alt med too, like chiropractic care. That's how I found out a few things in my late 30s. I had a really good chiropractor. I know, controversial. Don't give a shit. Anyway, if you haven't done something to love yourself today, please go do that. And if you don't know what that looks like, drop a girl a message. I'm going to help you out. Until next time, all my love.